Local 4 News Morning starts right now.
As many of you know, staying healthy isn't always easy, but knowing your family history can definitely help. Joining us this morning is Dr. Zanger Hain from Oakwood Hospital, along with Rose and Ann Hollingsworth from the Oakwood Genetic Counseling Patient Program. We're going to hear more from you in a moment. But Doctor, I want to begin with you. Talk to us, especially during this holiday season when many families are getting together, what type of conversations we should be having to learn more about our medical past.
Well, since 2004, the U.S. Surgeon General has really been encouraging people to learn about their family's health history. And when people are together during the holidays, this is a great time for the more senior generations to be sharing their health information with the younger generations.
And what type of information should we specifically be asking for? Because as you know, there are so many genetic conditions out there. So should we just be having this conversation to begin with?
Yeah, have the conversation and be asking questions about, well, what type of health concerns have you had over your lifetime? Whether we're talking about diagnoses of cancer, diabetes, heart disease, stroke, any health concerns that you've had. And you want to know, well, how old you were when you had them. Age is a really important key factor we look at to say, okay, is this posing a risk to other family members? If there's an early age of onset, there's a greater risk than if it's a later age of onset. We're looking to see if there's more than one family member with the same diagnosis. Again, that can pose an increased risk to other family members.
So Rose and Ann have gone through the program, and I want to talk to both of you about how it helped you learn more about yourself. So I guess I want to start with you. Did you just start asking some of the older members of your family?
Yeah, I started talking to my grandma. It's something we've always had a very open dialogue about, her health history. And I learned that when she was 28, she was diagnosed with breast cancer, and her mom was in her mid-40s when she was diagnosed. So as I got into my 20s, it became more of a concern for me to know more about it.
And important, I would assume, for you to be able to share that information with the family.
Yes, Ann and I have always been very close and open, so she was very well aware that I had it, and she was concerned for herself.
Well, doctor, talk to us about what patients who are watching right now, viewers who want to learn more about how they can tap into this important resource. What should they be doing right now?
Well, first of all, you have to have that conversation. Rose did a wonderful thing for her family by sharing her health information so that Ann could then go ahead and say, okay, I'm at risk. What do I need to do to help decrease that risk or get the appropriate screening testing? So you need to ask those questions, and then once you have that information, you need to write it down. Many times we forget what that information is. And then once we write it down, we need to share it with our healthcare professional so that you can come up with a screening program and a prevention program to take the best care.
And always a good idea, as you mentioned, writing things down when you go to your doctor, to bring a notepad, write things down, or maybe bring along a family member, because sometimes we forget that important information. So thank you all for being here this morning. We really appreciate your time. Doctor, thank you also. And for more information on this program and Oakwood Hospital's genetic counseling, you can head right to the Scene on 4 section of our website. All the info will be right there at clickondetroit.com.